Hello and welcome. Today, we're going to talk about something a lot of people deal with, an overactive thyroid, or hyperthyroidism. All the information we're covering comes straight from patient education materials created by Dr. Praveen Ramachandra, a senior endocrinologist in Bengaluru, so you know you're getting clear, expert-backed insights.
So, have you ever felt like your internal motor is just stuck in high gear? You know, that constant feeling of anxiety, maybe your hands are a bit shaky, or you're dropping weight without even trying. If any of that is ringing a bell, then you are definitely in the right place to get some answers.
Here's our game plan for today. We're going to start with the signs your body might be sending you. Then we'll clear up a couple of important terms that sound similar but are actually different. After that, we'll dig into the root causes, the why behind it all. Then we'll cover how doctors diagnose it and, of course, the most important part, the different paths to feeling better.
Okay, so first up, let's tune in to what your body might be trying to tell you. These are those classic telltale signs. You know, the easiest way to wrap your head around this is to think of your body's metabolism as a car engine. With an overactive thyroid, that engine is basically redlining. It's running way too fast, burning through fuel and energy at a really high speed. And because that engine is running so hot, you get all these different symptoms. You might notice your heart is racing, or you're losing weight for no reason. Maybe you feel anxious and irritable all the time, or you have a slight tremor in your hands. Feeling hot and sweaty when others are comfortable is a big one. And here's the weird part. Even though your body's in overdrive, you can feel completely exhausted. For women, irregular periods are another huge clue. These are all direct messages from your body.
All right, this next part is super important for understanding what's really going on. You're going to hear two words a lot: hyperthyroidism and thyrotoxicosis. And as Dr. Ramachandra points out in his materials, they sound alike, but the difference between them is actually pretty critical.
So let's break it down. Hyperthyroidism means the problem is with the thyroid gland itself. It's the source, the factory that's working overtime and making too many hormones. Thyrotoxicosis, on the other hand, is the condition your body is in. It means your body's tissues are being exposed to way too many thyroid hormones, but the source could be anything: the overactive gland, a damaged gland that's leaking hormones, or even taking too much thyroid medication. So hyperthyroidism is simply the most common cause of thyrotoxicosis.
And that brings us right to the next big question. Okay, so why? Why is this happening in the first place? Let's get to the bottom of the root causes. Well, when you look at the numbers, one cause stands way out from the rest. A massive 80% of cases are caused by something called Graves' disease. About 15% are from what we call toxic nodules, and the last 5% are from other things like inflammation of the thyroid. So let's quickly touch on each of these.
So Graves' disease is the big one. It's an autoimmune condition. That just means your immune system gets its wires crossed. It creates these antibodies that are supposed to fight off germs, but instead they mistakenly latch onto your thyroid and hit the gas pedal, telling it to produce more and more hormones.
Then we have toxic nodules. You can think of these as little rogue factories that pop up on your thyroid. They're lumps that just start pumping out thyroid hormones all on their own, completely ignoring the body's normal command system that would tell them to slow down.
And finally, there's thyroiditis. That itis at the end of a word just means inflammation. So the thyroid gland gets inflamed, maybe after a virus or something, and it starts to leak out all the hormones it had in storage. The most important thing to know about this one is that it's often a temporary state that can get better all by itself.
So with these different possibilities, how do doctors actually figure out what's causing the problem? Let's walk through the path to getting a clear, solid answer.
The whole process is usually a very logical three-step journey. It almost always starts with simple blood tests to see what your hormone levels look like. The next step is often a special scan called a radioactive iodine uptake scan, or RAIU. This basically shows how thirsty your thyroid is. And finally, another blood test can be done to look specifically for those Graves' disease antibodies. That RAIU scan gives a huge clue. See, if your thyroid is really active and soaks up a lot of iodine, that's called a high uptake, it's a massive signpost pointing towards Graves' disease. But if it barely takes in any iodine, a low uptake, it suggests hormones are probably just leaking from an inflamed gland, like in thyroiditis. It's a clever bit of medical detective work.
Okay, so you have a diagnosis. Now we get to the most important part, right? The paths to actually feeling better. Let's dive into treatment and management.
The great thing is that treatment is tailored right to the specific cause. For Graves' disease, doctors will typically use antithyroid drugs to tell the gland to just slow down a bit.
For those toxic nodules, the goal is to get rid of those little factories either with radioactive iodine therapy or with surgery. And for thyroiditis, since it's often temporary, a doctor might just monitor you and use other meds to help with symptoms while it resolves on its own. And speaking of managing symptoms, while those main treatments are getting to the root of the problem, there's help for how you're feeling right now. Medications called beta blockers are fantastic for quickly getting things like that racing heart and the shakiness under control. They can give you real relief while the primary treatment starts to work its magic.
Now, this is probably the most crucial point to take home. This isn't a one-and-done kind of fix. Dr. Ramachandra really emphasizes this. Regular follow-ups with your doctor are absolutely essential. It's a partnership. This is how you make sure the treatment is working for you and prevent any long-term complications, like bone loss.
And that brings us to the end. So we've covered the signs, the causes, the diagnosis, and the treatments. Now that you're informed, I want to leave you with one final thought. What is one good question you can ask your doctor at your next visit so you can be an active partner in your own health journey? Thanks so much for listening.